Welcome everyone to Whole Body Health, starting with your mouth presentation by Ivory Dental Studio.
A graduate of the University of Detroit Mercy School of Dental Medicine, Dr. Harjeet Gill is very proud to provide all aspects of comprehensive dentistry to the Niagara regional community. She is passionate about providing excellent personalized dentistry to her patients and strives to provide gentle and customized dental services. Dr. Gill continues to be a lifelong learner herself. She is an active member of the Dawson Academy, the American Equilibration Society, Bale Doneen Method, American Academy of Oral Systemic Health, and other institutions for continued education. Dr. Gill has advanced knowledge and training in the temporomandibular joint, disorders of the temporomandibular joint, bite disorders, and sleep apnea. She approaches dentistry with accuracy, precision, and artistic perspective. Outside of her profession, Dr. Gill strives to maintain mindfulness in her life and loves being a wife and a mother to her 5 children. In her free time, Dr. Gill truly enjoys cooking and reading, and most of all, spending time with her family.
Thank you so much, Karen. Let me tell you a little bit about Karen. As a registered hygienist with more than 25 years in clinical setting, Karen engages her clients to be partners in their own health. Outside of her clinical role, she enjoys time with her husband, 2 children, and her dogs, often found tinkering in the garden or cooking. Well, let me tell you a little bit about Amy. Amy's going to take the role of receptionist at Ivory Dental Studio. She joins us with 20 years of experience in dental field. Amy takes pride in educating her patients to help them make informed decisions about their oral health. Aside from Amy's passion for dentistry, she's a proud mother of 2 teenagers, enjoys time to read, golf, and travel. I sure am blessed to have them with us, and our practice and patients will be fortunate to have them both. We're located on 5932 Dorchester Road at the intersection of Lundy's and Dorchester Road. We're only minutes away from Costco and Walmart Supercenter. Let me tell you a little bit about our clinic. At Ivory Dental Studio, we've changed our focus from just saving teeth to detecting and managing the issues early that lead to gum disease and cavities. Our philosophy is anchored on strong foundation, healthy gums, balanced bite on sound joint structure, and cavity-free teeth. The bacteria in your mouth is as unique to you as your fingerprint. We now have the technology to identify the specific bacteria, yeast, or viruses that cause your body to respond and create bleeding and inflammation. At Ivory Dental Studio, diagnosis and treatment will be discussed on your personal risk assessment and causative triggers. Your overall health is our top priority. High-risk bacteria that cause gum disease is one of the key inflammatory root causes, so whether it's cavities or gum disease, treating symptoms is only putting a band-aid. At Ivory Dental Studio, treatment will be customized to your unique bacterial ID, determined by simple and pain-free spit and plaque sample. In doing so, we want to make sure that your mouth only contributes to your greater well-being. Cass Nelson Dooley, in her book Heal Your Oral Microbiome, calls gum and gut kissing cousins. As you can see, your GI tract is one continuous tube, starting with your mouth at the top, ending with the anus on the bottom. Our mouth and gut microbiome consists of both good and bad bugs. When the bad bugs rise to power, it results in chronic inflammation. In the mouth, the inflammation shows up as periodontal disease, and in the gut, it manifests as inflammatory bowel disease such as Crohn's. Bacteria from the mouth travel downstream in huge numbers via saliva. This is great if there is healthy bacteria in the mouth, but in case of pathogenic bacteria, it can be a constant source of problematic bacteria to the gut. For example, H. pylori bacteria, known to cause stomach ulcers, is also found in the dental plaque. In essence, mouth is the gateway to the body. This is a This is a video of plaque sample collected from a patient's mouth. I want to draw your attention to these little buggers swarming around. What do you think this is? Spirochetes. Spirochetes are pathogenic oral bacteria that escape our immune system and establish chronic infection and sustained inflammation. There's a lot of research out there on spirochetes. These silent little buggers are doing more harm to your body than good, especially in the mouth. And because they don't hurt, they're really silent saboteurs in the mouth. Here's a video of two samples, one taken from a healthy mouth and the other from a diseased mouth. What's the difference between these two slides, healthy versus the diseased slide? What was the one big thing you picked on? If it was me, the first thing I noticed is that in a healthy slide, there's not a lot of movement. But in the diseased one, there's all kinds of movement. Little spirochetes digging away at everything. This is a study from 2006 in the Journal of Periodontology where Dr. Anne Haffagi and others concluded the ultimate risk for any infectious disease is the causative agent of that disease. And by identifying the causative pathogens prior to the manifestation of disease, we now have the ability to actually prevent the disease. With the phase microscopy right on site, we'll be able to screen for pathogenic bacteria in our patient's microbiome. Gum disease is a common bacterial infection affecting more than half of people 30 years and older and 70% of people over the age of 50. Gum disease is an infection that can cause bleeding of the gums, inflammation, and even tooth loss. It's an infectious disease because we can spread it to others through kissing and sharing drinks. Sometimes the infection is obvious because the gums bleed, and at other times it isn't so obvious because we cannot see or feel these bugs. Interestingly, these dangerous bugs don't just stay in the mouth. They get into the bloodstream very easily through activities like chewing our food, improper brushing and flossing, and even while our teeth are being cleaned. Remember, you can be sick with a healthy mouth, but you cannot be healthy with a sick mouth. It is now widely acknowledged in the functional medicine community that chronic inflammation of any sort can seriously affect health. Inflammation is our body's defense in response to injury or disease and is necessary for restoring health. It is detrimental when that inflammation goes into an overdrive, leading to chronic inflammation. Chronic inflammation is one of key factors that works at the core of all chronic ailments, such as heart disease, stroke, diabetes, cancer, chronic pain, and Alzheimer's disease, and all the others listed here. Because we're limited on time, I'm only going to focus on the consequences of gum disease and cardiovascular disease. The human microbiome is made up of 100 trillion bacteria, fungi, protozoa, and viruses that live in and on the body. There are 10 times more of these bacterial cells than there are human cells in your body. Most of these microbes reside in your gut. Human microbiome has both good and bad bacteria. Luckily, 99% of them are stable and in harmony with us, providing benefits such as producing essential vitamins, extracting energy from food we eat, regulating our immune system, protecting us against disease-causing bugs, and regulating our glucose levels and metabolism. Did you know that the bacteria that lives on your tongue is the source of 25% of the total nitric oxide, which can help lower your blood pressure? How does that do that? So let's take a look. When you eat foods, green leafy vegetables that are rich in nitrates, it gets absorbed by your upper GI tract. 75% of it gets excreted, while 25% gets reabsorbed and picked up by your salivary glands. Silent protein, along with oral bacteria that lives on the back of your tongue, converts nitrates into nitrites and finally into nitric oxide. What is nitric oxide? Nitric oxide is a potent antimicrobial agent and a vasodilator. Notice how constricted this vessel is on the left compared to the one on the right. Which one do you think is easier for the blood to flow through? The one that is constricted has to push harder, making the blood pressure to go up. And when it's dilated, the blood flow in this one is much easier. Hence, the blood pressure goes down. So to sum it up, in dilated vessels, the blood flows easily and keeps your blood pressure down, and constricted vessels raise the blood pressure. Now, this is a recipe that I've taken out from Dr. Joel Kahn's Whole Heart Solution book. Recipe to put on your plate tonight. We are giving away Dr. Joel Kahn's latest book. My team member is going to post our office email address. If you'd like to enter into the contest to win a copy of this book, send us your request to the email and write us a comment. Saliva is vital to keeping your mouth healthy. Acid is damaging to teeth. Saliva controls the pH of your mouth by constantly keeping the calcium and phosphate levels high, rebalancing it to basic pH. Saliva contains the enzymes and immune system protein. An average person swallows 1 liter of saliva every day, which amounts to 100 billion bacteria each day. About 700 species of bacteria have been identified in the human mouth. The most diverse microbiome, second to gut microbiome, according to a study published in Journal of Bacteriology. There is balance between good and bad bacteria in a healthy person. When there is more good than bad, we have health. However, when this balance shifts from good to bad, we shift from health to dysbiosis. Dysbiosis is another fancy term for disease that can happen with medications that can cause dry mouth, low pH, or unprocessed diet that is lacking nutrients. Breach in the oral mucosal barrier due to gum disease leads to invasion of high-risk pathogens in the bloodstream. When the plaque layer on your gums keeps forming constantly and you don't do a good job of removing that plaque, the gum responds with a full body alarm. White blood cells come to the rescue to clean up the invasion and give the gums a reddish hue, hence gingivitis. If this insult from the bacterial overload continues, the gums begin unzipping from the teeth, forming deep pockets underneath. Bacteria hides in these pockets and is hard to clean with a toothbrush. There is constant immune patrol of white blood cells producing toxins that break down the connective tissue and bone that hold your teeth. So next time you go to your dentist, make sure you remember your pocket depth number. If your numbers are 4 and above, be sure to get your teeth cleaned professionally every 3 months to keep those nasty bugs from digging deeper. Let's see how cavities are formed. Bacteria, together with sugars from processed diet, drinks that are high in fructose, produce a very acidic environment in your mouth. Acid pulls the minerals like calcium and phosphate out of the healthy tooth, making the tooth weaker and prone to bacteria. When the bacteria gets into the tooth, it's going to resolve the tooth away, leading to what you've heard as cavities. But what most people don't think about is that tooth is an organ with its own blood supply. And through this blood supply, it's connected to the body. If the cavity is not resolved and the bacteria travels to the center of the tooth, it's an open path to the body. And how it escapes into the body and start causing systemic inflammation, especially blood vessels, making them more vulnerable to plaque accumulation. This over here is the acidity level of a battery. Very acidic. And on this end of the spectrum is your mouth tooth whitening bleach. Very basic. Of course, all the drinks we're drinking out there fall within the spectrum. Sadly, most of the drinks, the soft drinks, fall on the acidic side. So now let's look at something you might not have realized anywhere on the spectrum, and that's the pH of the bottled water. Everybody thinks bottled water is safe and healthy, but from a pH standpoint, it may not be. For example, Dasani, it's assumed to be healthy, but it's on the acidic side. Another supposedly healthy drink, vitamin water, has a pH of 3 and 8 teaspoons of sugar. How healthy is that for your mouth? You really got to check those labels out before you buy any fancy healthy drinks. %of American adults have gum disease. 83.6 million American adults have one or more types of cardiovascular disease. So what's the connection between cardiovascular disease and periodontal disease? Let's take a brief look at what bacteria, the periodontal bacteria, does to your heart. High-risk pathogens from gum disease get into the bloodstream and elicit an inflammatory response, which results in the release of pro-inflammatory mediators. Lipoprotein PLA2 is released in response to gum disease pathogens. Lipoprotein PLA2 increases plaque vulnerability and plays a direct role in cardiovascular progression. We're also giving a copy of this book, Beat the Heart Attack Gene, as well. So my team member is going to post our office email address. If you'd like to enter into the contest to win a copy of the book, send us a request to the email and write us a comment. Dr. Bale and Dr. Doneen have coined a new term, arteriology, the study of blood vessels. They go around the country and teach physicians about significance of preventative cardiology. Their Bale-Doneen method to prevent heart attacks places oral health as a key component in arterial health. They consider periodontal disease, endodontic disease, and airway health as root causes of arterial inflammation. Bale-Doneen research is the first to show that the high-risk pathogens, such as those that cause gum disease, gang up to create a triple threat to arterial health that can lead to heart attack and strokes. How do these bacteria do that? According to their research, there's 3 distinct ways that periodontal bacteria can cause artery plaque. People with gum disease have twice as much dense LDL cholesterol in their blood as those with healthy gums. Chemicals such as lipoprotein PLA2, only produced in the presence of high-risk oral bacteria, make it easier for bad cholesterol to invade artery walls. These chemicals make the inner walls of the artery stickier, like Velcro, so cholesterol is more likely to be trapped there and clump into plaque. This is a cross-section of the artery. As you can see, it's very healthy at this end and very sick on this end. Once the bacteria make their way into the intima media, which is the middle layer, it starts to thicken up with the plaque formed by bacteria, macrophages such as white blood cells, and LDL. This plaque will grow and eventually rupture, and the tear in the artery will result in a clot formation, which, if large enough, will clog the artery, blocking the blood to flow through the artery, hence causing a cardiovascular event such as heart attack or stroke. Now, as the plaque builds up, there are certain biomarkers that are given off at each stage. and they're pretty easy to measure. Your physicians usually use CRP to predict cardiovascular risks and outcomes. So if your CRP is elevated, ask your dentist to evaluate your gums for disease. Because of the close proximity of the mouth to your carotid artery, your dentist is the first to find carotid calcifications like these found in the carotid artery on a panorax X-ray. Chronic diseases take years to manifest before we experience symptoms. Consequently, it takes longer to rebound back to health. But every little step you take towards health adds up. Let's get started on some of the things you can put into action immediately to bring your body back towards balance and heal it from inside out. So some of the things that you can do starting today are brushing and flossing twice every day, going for a brisk walk, not so much today, but going for a brisk walk even for 20 minutes every day will cut your risk of getting cardiovascular disease. Visit your dentist every 6 months. Talk to your doctor if you have any family history of diabetes, cardiovascular disease. Watch your alcohol consumption. Quit smoking. Adopt an anti-inflammatory diet. And work on reducing those stress levels. Some of the ways you can do that is by adopting a hobby, laughing with family and friends, putting on those AirPods and listening to your favorite music, taking a walk in nature, and finding time to meditate. If you find signs of oral disease from active decay to bleeding gums, or if you're putting off the treatment your dentist recommends, think again. Healthy mouth is not only about saving your teeth for a lifetime, it may save your life. There may be some of you that have been putting off their dental visit for the last 2 years due to COVID. To put your mind at ease, I'd like to draw your attention to the study done at U of T by faculty members Dr. Glogar and Dr. Nunes. Their study concludes that dentists remain the safest profession amidst COVID. I'd love to share this study with you if you email us at our office email address. Thank you, and I'll take any questions that you guys may have.